The Doc is In is sponsored by Amada Senior Care.
We're happy to have Fox 56 News Chief Medical Contributor Dr. Ryan Stanton with us in studio once again.
He's focusing on the risks that come with taking those just-in-case antibiotics that you were talking about last hour.
Yeah, we talked about the just-in-case antibiotics. So what is the real risk? People need to know why. They need to keep those on the shelf, or better yet, at the pharmacy. Earlier, we talked about one of my least favorite medical reasoning phrases, and that's just in case, when prescribing antibiotics for viral type syndromes, which is the vast majority of what I'm seeing in the emergency department right now. Here are some of the major risks of antibiotic misuse. First and foremost, antibiotic resistance. GI side effects, that includes the nausea, vomiting, the diarrhea, the bloating. Dangerous opportunistic infections, just like C. diff colitis. We see that a lot in the elderly population. Fourth is going to be more expensive and frequent ER or hospital clinic visits. You actually end up sicker with these in many cases. And finally, serious immune responses. There are significant immune responses that can take place that can be fatal, dangerous, hospitalizing, whatever it may be. The key is that we need to be good stewards of antibiotics. In the end, people want to feel better, and with viral illnesses, we need to focus on comfort and managing the symptoms. For the vast majority of health folks with intact immune systems, significant bacterial infections are incredibly rare, and thus our use of antibiotics should also be very rare. So don't push for antibiotics unless there's indication for a bacterial infection, and ask questions. If you get the just in case, ask them, what am I treating? What's the bacteria that I'm trying, that we think we have right here? And if not, maybe take some time. If you're healthy with a good immune system, you can actually take a little bit of time with most, because our immune system will actually take care of almost all viral infections and a lot of the bacterial infections as well.
And what about any risks associated with maybe taking leftover antibiotics?
Yeah, absolutely. You shouldn't, because that means first and foremost, you didn't take them right the first time, because you need to take them through the entire prescribed course. And two, they may expire. They may not be the right ones. So you may just be, if it's even bacterial, you may just be getting the bad side effects without the benefits. So only prescribed when they're prescribed to take them for the bacterial infection that you have right now.